wonderful.
Hi everyone, this is Amu here. Welcome back to my YouTube channel. This video will be, I want to take you this video very short. On this video I'll be talking about the strategies you can use for passing the exam. And before that, I hope everybody's okay and everybody's doing well. Let's get started. So the first thing I want to say is so as I said in my previous video, the main thing you need to have for passing the exam is the content, the knowledge. You should be having that. If you don't have that, then I don't think if you use the strategies you can pass. I don't think so. So first thing, you have to really study the materials you have and the important topics you need to know for passing the exam. So all that you need to be thorough, and you need to be having some basic knowledge about it. Then if you have that, and if you use these strategies, these strategies which I'm gonna tell, I would say you can pass, but I'm not guaranteeing. But this is the techniques I used and which helps me to pass. So I believe you can also use that and try and see if that's gonna work for you. So as I said, the first thing you need is knowledge and the contents. So if you have that, the strategies you can use is so the first one is gonna be, when you get a question for your licensing exam or board exam, so what I did is read the last part of the questions, which is the part where exactly they're asking like what they need, what should be the answer. That's what they are asking on the last part. Because if the question is asking about a pregnant woman, and the last part is asking about what you should do in that situation, sometimes for the pregnant ladies, the priority would be baby, or perhaps some situations priority will be more the mother. So if you divert it by the topics you have read in the first part of the questions, you will be answering wrong. So the best thing you can do is read the last part of the question and see what that question is asking. And when you read that last part of the questions, one more thing you have to do is find the hints or the cues what they're asking. For example, they will ask, what is the best thing you can do in this situation? Or they will ask, what's the priority on this situation? Or they will ask, what is the most important thing you have to do on this situation? So you have to find that one too. So then you get a clear clarity for what they will be asking and what you should be answering. So a question, you got a question on your exam, so you read the last part of the question. So that will most probably says in the situation nurse will be doing this or that, or most important thing, something like that. So read the last part of the question, find out what they're asking. Then the next thing you do is, of course, you have to go for the first part, right? So you go read the first part. So when you read the first part, you get an idea what topics is about. Is it about geriatric client, or is it about a client who is having myocardial infarction, or the gynecology patient, something like that, or maybe pediatrics. So you get that topic. So you got the topic, you got the last part, then you have to convert that question, the main topic, onto in your own words. So that would help you find the right answer. But the one thing you have to remember, when you convert your question in your own words, and if you're not really making you don't really understand the question and you're making it in your own words, sometimes it might go wrong. So if that's you are that kind of person, and when you convert it goes something else, then I would say don't do that. Do find the last part of the question and find what they're asking and find the topic, and then see. So if they ask you about hypertension or anything metabolic acidosis, so remember as much information you can about that situation or that disease or that condition. Then then you go and read each answer. So now you have, before you go to answers, what you have is what they're asking exactly and what topic they're asking about, and you have enough information about that topic or whatever you know about that condition, you have it, right? So when you go, then you go to the answers and read, so then you won't be diverted. So that's the one thing which really helps me to crack the questions in NCLEX. So do that would be really helpful for you. Okay, so now you have the question, now you have the what topic they're asking, and what is the last part of the question, which is exactly what they are asking for you to choose from that 4 options or from all that I play. So you have all that. So now I'm gonna tell you about the strategies which I used to find which question is that or what kind of question is that. So the first strategy you can use is Maslow's hierarchy. So this all the strategies is not invented by me, because I have seen all the strategies from different books, different YouTube videos, and different online prep classes. I have seen that, and these are the ones I used and which helped me to pass my exam. So I'm just sharing with you people, so you guys can also choose which one will work for you. So about Maslow's hierarchy, everyone knows, we learned that from our first SEM. So when you get a questions, you can use for the priority questions, the best strategy you can use is Maslow. So you have to recognize both answers are the options they are giving you. All the options are either physical, or the other one is psychosocial. So if you get a question which has like 2 psychosocial and 2 physiological questions, so the first thing you have to eliminate that was psychosocial, because when you get a priority questions, the important thing you have to choose based upon the Maslow's is physiological. So you eliminate both psychosocial, or how many psychosocial answers you have, or emotional, whatever, you eliminate that. Then you left with 2. Sometimes you left with 1 physiological, which means that's your answer, but most of the time you get to have 2 2 physiological questions, so which means you have to choose from that. So once you have that 2, then you choose by using ABCs, used by you choose the answer from that 2 with ABC. So and what I did is I use ABC. Sometimes for me sometimes it won't work. So what I do is I see which patient has least time to save, or which I won't say critical, because that's not gonna help you. So what I did is I use ABC for that 2 leftover answers, and if that's not helping me, then I use which patient has least time, something like that. Or the other ones, if you really don't know which one to choose, I would say the new symptoms came up for a patient, that's going to be a priority, so you can use that. So most of the time if you get 4 options, and if you eliminate the 2 psychosocial, and then you're done with the physiological answers, and both ones are almost same, but one has a new symptom or new sign showing up within that 24 hours, then that should be your answer. So that's the technique I use for the priority. So you can use that, and it should really help you at least to eliminate 2 answers. Then you can at least fight with that other 2 and hopefully find the right answer. So the second one you can use for the priority is nursing process. So the priority questions, I believe for me, I got most of the questions were priority questions. So mostly you have to be thorough with the priority questions and the strategies you can use for the priority. So for the second one, I had on my notes is nursing process. Again, this was not invented by me. It was people were using the textbook has taught us from the first year of our nursing school. So this is there since then. So nursing process, you choose. So we know that the first thing you have to do is the assessment. So if you have answers 4 choices, and if you have data collection and implementation, so the first thing you use is data collection. So recognize whether it is a data collection or implementation answers. So if you in the questions, so if you have the data has already been collected, let's just say the question is saying that found a child lying on the floor, the leg is fractured, on the one side is fractured and there is a bleeding, something like that they said, which means the data collection is already done. So then they will be asking, the first thing you have to do is on that question the answer which should be implementation, because data collection is already done and they explain that on the questions. But if there is no data collection and they're asking you what you have to do first, then the first thing you have to do is assessment. So you depend on the stem of the question. You have to find if they're asking you to choose data collection or the implementation answer. So you have to do that. So the next one you can use for the priority questions is about safety. So this one I think I got from one textbook. I think that was from Kaplan I got it. All the answers should be implementation. So you see all the answers should are you read and there is no assessment. You see all that implementation. And so most of the safety questions is like when you do a procedure. So if you're doing or maybe the patient is done the laminectomy and you're going to position the patient, and what you will do or what you will be doing or something like that. Or the patient is at 37 weeks of gestation and the patient is in labor and she's having hypoxia or she's having respiratory distress, what you will be doing, something like that they will be asking. So all that mostly you have to answer based on your knowledge. You should be having an idea what you will be doing in that situation. So you have to use your knowledge to answer those questions. But if you cannot answer or you don't know that situation, what you have to do, but the best thing you can answer, the best way you can answer is you have to think what will cause the client the least amount of harm. So then you can choose that. So in that way, at least we are not causing so much harm to the patient. So mostly that would be the answer, but I would say you try to answer with your knowledge and try to recollect all the information you have about that situation. So that is that. And fourth one would be about positioning. For example, we can say laminectomy. So you are going to do something or turn the patient. So you are going to position the patient. So you will be saying like, are you trying to promote or prevent something? So what so then you got, I am preventing something on that situation. So for laminectomy patients, we should not bend, or we should not do anything with their spine, so that should be straight. So when you change the position, you should be knowing that, and you are trying to prevent that bending for laminectomy clients. So first thing, you see what you're trying to prevent or promote. Are you trying to prevent or promote? Then you see what are you trying to promote or prevent. Then you think about the least harm you cause when you do that, and that would be the answer. So safety and positioning is almost kind of same, but the best thing, you have to use your knowledge and recollect as much information you can, and then use this strategies, and that should help you choose the right answer, or at least you can eliminate 2 answers and you can find the right answer from that too. So the next one is therapeutic communication. So communication questions, for me, I didn't get much questions, but that's, I think the communication has 9% or something on the exam. So you should see that communication questions. So that's really important when you work. Also, that is really important about the communication, because you should be really careful and about the communication, and see what you can say to the patients, or the POAs, what you can say, or how you can communicate with them, how you can acknowledge their feelings, how you can respond to them with that. That's really important. So always try to eliminate don't worry questions. So when they say something, you say don't worry, it's gonna be okay. That's not a right answer. That's not a respectful way to acknowledge their feelings. So you should not do that. And when they say something, you should not be asking why. That's kind of inappropriate. Then the first thing you should be doing is you can acknowledge, like, yeah, I understand that this is happening to you. So then you create an open-ended question, so they can answer, they can like communicate further with you about that. And authorization answer. So you are not authority to the patients. Yes, you are responsible for their care, you are responsible for the treatment, but you are not responsible or you should not be authoritative to the patient. So you should not say do that. If they, let's say they come and say to you that this happened, and so as spouse of a terminally ill patient come to you and say that this is, I don't know how I'm gonna go through this or something like that. You should not say that. You have a kids and you have 2 kids and you can think about them, or you have a job, you can think about them, or you have to think something else and get through that. You cannot say that. That's all wrong statements you can pass to them. So you should not be authoritative, and you should never use closed-ended questions like yes or no questions. When you use that, then the answer will be yes or no, or just one word. That won't help you identify the issues or anything, or you're not acknowledging the patient concern. So you should not be doing that. And the last thing I would say is eliminate. You should not be focusing on our thing. So let's say you a patient came and tell you that or their parents came and tell you that my daughter is going through this, and the patient is daughter and the parents are telling you that they are going through this, and they are worried about that. So you should not say that, oh, this happened to me last year, or this happened to my friend last year, so they did this. So you can also do that. So you are not supposed to do that. You're not supposed to say that to them. You have to acknowledge, and you have to further continue the conversation to identify what their other concerns are. So yes, you have to do that. So all this should be helpful for you to remove the wrong answers and getting to the right answer for the communication questions. So these are the strategies I used to pass my exam. So I'm not sure that's gonna work for everyone, but you can try when you prepare when you prepare for the exam, you read the question, you can try these techniques and see if that's working for you. So a lot of strategies and tips many people shows on textbooks and videos. So these are the ones help me pass exam, but some people don't use all this. They just read the question and answer and they pass. Some people read the question and answer and they fail. So some have like really they have a lot of knowledge, so they can do that. I believe they can do that. But for me, even if I have knowledge for multiple choice, I am not really good at multiple choice questions. So I have to use some techniques, to use all the strategies to pass my exam. So if you want, you can use it. So, but I would say the best or the main thing you need is the content. You should be really knowledgeable about the about your textbook, about your NCLEX, all the topics. You should be really having a basic knowledge about it. If you have, then only you can use the strategies and pass your exam. If not, then I don't know how that's gonna work. So I want to include one more thing on this, SATA. So select all that apply it. It was really giving me so much pressure on my exam, because I'm really bad in SATA. It's really take time from me. So what I did is, when I was writing my exam for second time, what I did is I found this technique on I think her name is Simple Nursing, or Beautiful, not Simple Nursing, Beautiful Nursing. You can go and check her videos. She's so talented and she makes really helpful videos. I learned this SATA technique from her. She said you can use each answer and see if that's true or false. So you have a questions, you find the stem of the questions, you read the last part of the questions, and you know what the question is asking. So all you have to do is come to that, select all that apply, which might be 6 or 7 answers, and you have to choose the right answers from all that. So all the right answers from all that. So what I did is, and what she said is, so for each answer, read the first one and see if that is true or false about that topic the question is asking. So read the second question. So repeat till 6 or 7 answers. If you have it, repeat that and see if true or false. So whatever comes as true, then you put it as your answers. And it worked for me when I was practicing the questions. I tried doing that and it worked for me. So for example, they're asking you about a conduct precaution or an airborne precautions and what you have to do. So you have your questions, you know what they're asking, and you know the information about conduct precautions, right, or the airborne precautions. So you see the answers and think, okay, this is right for, is this true or false for airborne precaution? If it says, if you think that's true, this is okay for airborne, then that's true, and you choose that answer for your question. So that's how it worked for me. So most of the SATA questions will be like identifying the risk factors, all the risk factor for this issue, or some health teaching about it. So what you can tell to this patient when you're discharging, something like health teaching, they will come on that. And one other thing, sometimes they ask sign and symptoms for some disease, and they will give you one patient and say that this patient is having this, and expected outcome or expected sign and symptoms of that. Then they gave you 6 or 7, so then you have to choose from it, thinking like, is that true or false about this, true or false about this one? Then you got the answer, so you can use that. And the other one, when you get your questions, so except the strategies and the SATA, then the one thing you have to do is, sometimes a question asks you about a further interventions. So further interventions, when they ask you, it has positive and negative. So let's say the question is asking you, they said some stem, and they say which of the following answers shows that the patient understand the teaching. So you go for the positive answer. So you go for the positive and see if that is right about that condition, then that's your answer, because that's a right thing. Patient understand and patient said, so that's a right thing. So for the negative, they say what's the wrong. So they will say, so patient, you have given the education, health teaching the patients, and if the patient states which of the following, the patient need further education, or you need to do the further intervention. So that case, you're looking for the wrong answer, or you're looking for the negative answer, because which is wrong about the topic. So that might be confusing, because for the first time, I know that when I was doing the practice question, I was confusing and I was making it wrong. So what I did is, when I read the question itself, I will mark it as they are asking the wrong answer, or the wrong information they are asking. Or if they are asking for the right information, I'll write it as right information. So by the end, I'll see and check if I got the right one, so I don't confuse it. So you can use that too. Yeah, so that was all the techniques I use, techniques or strategies, you can say, I used to pass my RN and RPN exam. So you guys can also use that. And I hope this video is helpful, at least for a few people, and you can get the strategies and use for your test and for your practice questions. And I hope whoever is trying to pass the RN or RPN exam, I hope you will pass on your first attempts, and I wish everybody all the best. And thank you for watching my video. Bye bye.